So I'm Jenna Cassidy. I'm the Quality, Health and Safety Lead Auditor for Medstrom. What that entails is I'm responsible for conducting internal audits and responsible for the health and safety of the business. As a business, we've always had quite a strict infection control regime in place, with us working for predominantly the NHS. So our infection control has always been paramount in the business. All we've really done is strengthen those policies and procedures that we've had in place. So there's sanitisation stations across the business for people to sanitise their hands. It's mandatory mask wearing in all areas of the business. We tend not to promote vehicle or van sharing. If they have to, if it's a two-man install, then it's mandatory wearing masks in cabs with windows open. Regardless of the size or the structure of the service centre, they should all run in the same manner. So there should be a clean area as opposed to a dirty area. Decontaminated product shouldn't be in contact with contaminated product. Ensure that all the racking is safe, that the structure, that the technicians in there are all adequately trained within health and safety, identifying hazards and risks, and ensuring that every area of the business has got a risk assessment in place. We've implemented quite a few measures with social distancing. So within the office areas, we've reduced the amount of desks that we have in head office. We are strongly promoting the work from home ethic for those that are office based, so if they can work from home, to work from home. Those that are essential, that need to come in, that are office based, we've taken desks out, we've put perspex screens around the desks, we've put social distancing bubbles across the business in all areas, warehousing, the service centres and the office, to give that perception of how close you are to people. We've also introduced regular cleaning regimes, so mandatory cleaning on wiping down of hotspots, meeting rooms, touch points, door handles. So as a business, we provide regular updates via a webinar that tends to be once a month, that's sent to all staff. So it tends to be our managing director and our clinical director that's on the call, and then we have guest speakers for the likes of myself or our HR manager. And what we do is we promote and communicate with the staff as to what's going off. So because we operate as a business across the entire UK, some of the COVID rules and regulations slightly differ, but collectively as a business we follow one set of rules whilst we're at work, and we found that that's quite positive, that people then get the understanding of how COVID affects the wider population and what we're doing to keep everybody safe. We are a 24/7 business and we have continued to run, and it's just ensuring that people are safe in the workplace and that when they go home, they're safe to go home, they're not taking anything home with them. And I'm really proud as a business to say that we have not had one person out of the entire business that's contracted COVID from operating within a hospital or ward setting. The staff that we have across the business has reacted phenomenally to the changes that we've made. They're all quite positive that we have their health and safety at the forefront of what we do. We're not a business where it's about making money, it's about people being safe, our internal people, our employees, our visitors and also our customers. And actually I love it. I just love the people that I work with. It's like working for a family. The fact that you can go and have an open conversation with a managing director about what you've done at the weekend, and have a laugh and a joke, and you can go and do that with one of the service technicians. But I do love working for Medstrom, and I can't see me ever wanting to work for anybody else.